My name is Raylando Betances. I work for Care Medical. I am a physician assistant. I graduated in 2019 from Duval College. So once I realized the impact that I can have on the community, it really drew me to family medicine. I would say right after high school, I kind of ran into some health issues, and I was spending a lot of time in the hospital. Once I realized how much of an impact you can make on the community, I decided to be a phlebotomist. And after being a phlebotomist for probably about 6 to 9 months, I seen that there was more to be done. So that's when I pursued physician assistant. I would say the most challenging part about my job and the specialty would probably be like a lack of resources in the community. I mean, you want to really help these patients and give them everything they need, but it's hard when you're in the Lower West Side, kind of underserved community. We've been doing a great job building a lot of connections within the company. But there's still a lot of work to be done as far as getting the patients everything that they need. As far as getting comfortable with patients, treating them, treatment plans, actually coming up with a diagnosis, I would say about a year out of school, you're pretty confident that you can help the patients. It's a learning process no matter what. I still look things up on UpToDate every day. I'm still kind of reaching out to the resources around me. I have plenty of doctors and other physician assistants that I lean to for help if I do need anything. So you have the resources around you just have to really know how to use them. Every patient is different, and every patient's going to have different things that come between them and getting the care that they need. There's a lot more than just medicine that I have to think of. I have to think about the patient's, transportation, food, housing. Once the patient walks out of the door, am I comfortable with the resources that they have around them to help them? No. Every day I walk out of here, I give somebody a referral, whether they can get transportation to it, language barriers, things like that. Those are all big concerns for me. The amount of patients I see on a daily basis can average from about 10 to 25 patients. I recently took on a new role in the office that holds a little bit more responsibility. The patients are a little bit more high risk, patients that have had recent strokes, heart attacks, a lot of chronic conditions that just aren't managed well, a lot of high ER utilization, just trying to get them the access to care that they need to keep them out of the emergency room. So it really depends. On a normal day, if I'm just here seeing the day-to-day patients, I would say I probably see around 20 to 25. And when I'm focusing more on the high-risk patients, I would say I probably see around 10 to 12 patients. In this office specifically, I have a lot of freedom. I have a great medical director that I can reach to if I need anything for any help. And like I said, I have plenty of resources around me. But as far as the decisions that I'm making on a daily basis, I pretty much make just about all of the decisions. If I'm having trouble with anything, I can reach out to my medical director. We have a general surgeon upstairs that I can also reach out to if I have any concerns for him. Physical therapy, OBGYN up at the front in the front building as well. So as far as autonomy, I can pretty much make any decision I'd like, but I do use my resources pretty often. Well, when I first got out of phlebotomy school, I actually took on a job as a trained medical assistant with Urban Family Practice, the formal company that I currently work for. It didn't take too long before I decided I wanted to go back to school and help the community a little more. So I was only a medical assistant for about 6 to 9 months before I started school back up to pursue being a physician assistant. The transition wasn't too difficult because I knew I was coming back to the same place I originally started. The same patients that come through the door, a lot of them were here back 10 years ago when I started to work as a phlebotomist. So it wasn't really a big transition. It was actually very rewarding when I seen the patients and how happy they were to see my face again, and to see after about 4 or 5 years of schooling that I was back to help the community that I originally started with. If I can do it, you can do it. After you get out of school, you take your boards, you pass your boards, you're never going to feel prepared. You're going to start the first day at your job and you're going to think you know nothing, but you know a lot more than you think. You went through a lot of schooling. You've been through years and hours of rotations and dedication to the field that you're going to be pursuing for the rest of your life. So you know a lot more than you think. You just have to be confident that you're doing it for the patients, and you just have to be confident in yourself. That's about it. Being that I'm from this community, when I was younger, I grew up right around the corner from here. There's some buildings behind me I used to climb as a kid, so it was very, very easy for me to come and serve this community. I didn't think to go anywhere else. I was actually thinking about that question a little while ago, and I was trying to come up with a solution for it. There's a lack of knowledge when you're going through school. So in the inner city, how much exposure are these kids from middle school throughout high school actually getting to different careers? You kind of learn from who you're around. And I think if we did a better job at exposing younger kids to the medical field, if we expose younger kids to different trades and different opportunities, it would kind of open their mind up a little bit to want more. Being from this community, I mean, there wasn't much of an option when we were in high school. I mean, we knew we had to go to college, but after that, we really didn't know what else to do. So introducing something like that would be great. Me, myself, I've been trying to figure out a way to introduce kids in the inner city to the medical field. I mean, I'll do my part on that, but I'm not sure how far I'll get with it. I think it'll make a very big impact.